If you haven't tested flexion and lying yet, here's the next thing to test. If you're having low back pain, possibly even some pain that comes down into the legs, like sciatica type stuff, it's more common that extension will help, right? Because we usually feel worse with sitting or bending, and you feel a little better when you're up moving around. But some people do respond to flexion and lying. So if you haven't tested flexion and lying yet, you're missing out on a very powerful piece of information. So when you lie flat and you bring the knees up to the chest, what we get here is lower lumbar flexion, but without any kind of nerve tension because the knee is bent. So when you test flexion and lying, you want to make sure you get a good 10, 15, 20, 30 reps of flexion and lying. And you want to see what changes. How does this movement affect either your back or your leg pain? Red light would be as you test it, it's moving further and further down the leg and it's staying. A green light would be as you keep doing it, it's actually moving up the leg and feeling better. That's two of the options. The most common thing is that it's a yellow light. It kind of hurts to do, and then I stop, it feels about the same. Or it feels slightly better to do it, and then when I stop, it's about the same. But glean some information from flexion and lying, and then when you stand back up, you want to retest those baselines. How does it feel when I move my hips to the left? How does it feel when I move my hips to the right? How does it feel when I bend forward? Based off of how you feel from that movement test, flexion and lying, it will either tell us that yes, it's correct, keep going, or no, flexion is wrong for you. It's worsening my symptoms, and I likely need extension going the other way.